When it comes to men's health, few topics are as misunderstood, as shrouded in shame, and as surrounded by half-truths as masturbation. I often see patients in their 50s, 60s, and 70s who lean in quietly at the end of an appointment and ask, almost as if confessing a secret, "Doctor, is masturbation bad for me at my age? Should I stop?" And here is the truth. Nearly every man has had this question at some point, but very few feel safe enough to ask it. Cultural taboos, misinformation on social media, and even outdated medical advice have made this simple and natural topic confusing, even frightening for many men. Let me share one striking figure. Surveys show that over 80% of men continue to masturbate well into their 60s and 70s, yet less than 30% feel confident that they understand what it does to their body. That gap between what men are doing privately and what they understand about it has fueled decades of myths. Some men believe it drains testosterone. Others fear it weakens erections, enlarges the prostate, or even shortens lifespan. On the flip side, some are told it is a miracle cure for every urologic problem. Neither extreme is accurate. Here is what the research shows. Masturbation, like any other sexual activity, has physiological effects, hormonal responses, and implications for both pelvic and prostate health. But those effects are far more nuanced and far less frightening than the myths suggest. So, in this consultation-style video, I am going to take you through what decades of medical research actually say. We will talk about how masturbation affects testosterone, erections, and prostate health. We will explore what it does for the brain, the bladder, and even sleep. And most importantly, I want to give you clarity, the kind of clarity you deserve but may never have received from a doctor. Think of this as a one-on-one appointment where we separate fear from fact. My goal is not to encourage or discourage, but to inform you so you can make the best decision for your body, your health, and your confidence. By the end of this video, you will understand the secrets older men often wish they had known decades earlier, not tricks or gimmicks, but truths grounded in science and clinical practice. Because here's the bottom line. Masturbation is not a shameful act. It is simply one form of sexual expression. And like exercise, food, or sleep, its impact depends on context, frequency, and the individual. When we clear away the myths, we find that it can be neutral, sometimes beneficial, and rarely harmful if understood and approached wisely. So let us walk through this together. I will break down 6 powerful insights, each one a key piece of the puzzle. You will see the science, hear the analogies, and walk away with real tools you can apply immediately. You deserve clarity, not fear. And that starts right here. When men first ask me about masturbation, the very first concern that almost always comes up is testosterone. Doctor, am I lowering my testosterone every time I do this? It is such a common worry that it deserves careful unpacking. Here is what the research shows. Testosterone is a hormone produced mainly in the testes, and its levels fluctuate naturally throughout the day and across a man's lifetime. After age 30, testosterone tends to decline gradually, usually about 1% per year. That decline is normal and driven by aging, genetics, body composition, and overall health, not by masturbation. Several studies, including controlled trials published in the Journal of Clinical Endocrinology and Metabolism and referenced by the National Institutes of Health, have looked specifically at whether ejaculation causes measurable changes in testosterone. The answer is that in the short term, there can be small temporary fluctuations. For example, some studies observed a slight increase in testosterone after several days of abstinence. Others noted brief hormonal shifts right after orgasm. But importantly, these changes are minimal, temporary, and do not translate into long-term suppression of testosterone. Think of it like this. Skipping a single workout might make you feel weaker that day, but it does not erase your overall strength. Similarly, masturbation does not erase or drain your testosterone. Your endocrine system is resilient and carefully regulated, more like a thermostat than a fragile glass. Now, there is an important distinction to make. Chronic illness, obesity, poor sleep, alcohol overuse, or certain medications can suppress testosterone significantly, but masturbation, whether frequent or occasional, is not on that list. The Mayo Clinic and Harvard Health both reinforce this. Masturbation is not a risk factor for low testosterone. Here is another key point. Testosterone is not just about muscles or erections. It influences mood, motivation, bone strength, and even red blood cell production. That is why it is so important to address real factors that lower testosterone, like poor sleep, high stress, and lack of physical activity, rather than blaming masturbation. So what is the takeaway for men over 50 or 60? Masturbation is not a culprit in testosterone decline. If you are feeling fatigued, noticing muscle loss, or struggling with libido, it is worth checking your levels with a physician. But the solution will likely involve lifestyle, nutrition, sleep, or in some cases medical therapy, not abstaining from masturbation. Here is a simple tip you can start with. Protect your testosterone by focusing on sleep. Research from the University of Chicago shows that even 1 week of sleeping less than 5 hours per night can drop testosterone by 15%. That is a far greater effect than anything masturbation could do. So if you have been carrying guilt, let it go. Your body is not draining itself every time you release. Instead, think of masturbation as a neutral factor in testosterone health, one small part of a much larger hormonal picture. When we talk about masturbation in aging men, the prostate almost always enters the conversation. The prostate is a small gland about the size of a walnut that sits just below the bladder. Its job is to produce the fluid that nourishes and protects sperm. Because of its location and function, it is directly involved whenever a man ejaculates, whether through sex or masturbation. Here is where myths creep in. Many men have heard that frequent ejaculation wears out the prostate or that masturbation somehow enlarges it or triggers cancer. Others have been told the opposite, that regular release protects the gland like a cleansing routine. So, what is the truth? Let us start with research. A large-scale study from Harvard published in European Urology followed nearly 30,000 men over almost 2 decades. The researchers found that men who ejaculated more frequently, around 21 times per month compared to 4 to 7 times, had a lower risk of developing prostate cancer. The exact reason is still debated, but one theory is that ejaculation clears the prostate of inflammatory substances or potential carcinogens. Another possibility is that it simply reflects better overall sexual health, which often correlates with healthier lifestyle patterns. Now, that does not mean masturbation is a cure or prevention strategy on its own. Prostate cancer is influenced by age, genetics, diet, and hormones far more strongly than by ejaculation frequency. But the idea that masturbation is harmful to the prostate simply does not hold up to the evidence. In fact, moderate, regular sexual activity, solo or with a partner, appears to be protective rather than dangerous. Think of the prostate like a sponge. If it never gets squeezed, fluid can stagnate. Ejaculation, whether from sex or masturbation, is one way the gland clears itself out. Of course, it is not the only factor, but it is a natural part of how the prostate functions. What about benign prostatic hyperplasia, or BPH, the non-cancerous enlargement of the prostate that causes urinary symptoms in many men over 50? Studies are less clear here. Ejaculation itself does not cause BPH, and it does not cure it either. However, some men notice temporary relief in urinary symptoms after ejaculation, possibly because the gland relaxes once fluid is released. So where does this leave us? The science reassures us that masturbation is not harmful to the prostate. If anything, it may support prostate health as part of an overall healthy lifestyle. But more important than frequency is vigilance, knowing your risks, talking with your doctor about family history, and getting routine screening as you age. Here is a practical takeaway. If you are over 50, ask your doctor about prostate-specific antigen PSA testing and digital rectal exams. These tools, combined with lifestyle habits such as maintaining a healthy weight, exercising, and eating a diet rich in vegetables and omega-3 fats, have a far stronger impact on prostate outcomes than whether or not you masturbate. And remember this, you deserve clarity, not fear. Masturbation does not damage your prostate. Instead, think of it as a natural function of your body, one that when placed in the right context may even help support long-term health. One of the most persistent fears I hear from men in their 50s, 60s, and beyond is this, "Doctor, I think masturbation is making my erections weaker." It is an understandable concern. Erections naturally change with age. Testosterone declines, blood vessels stiffen, and nerves become less responsive. Combine that with myths spread online, and it is easy to assume masturbation is to blame. Here is what the research shows. Erections are not just a switch that flips on and off. They are the result of a finely tuned system involving blood flow, nerve signaling, and muscle support. And one of the least discussed but most important elements of this system is the pelvic floor. The pelvic floor muscles are a sling of muscles that run from the pubic bone to the tailbone. They support the bladder, bowel, and prostate, and they also play a direct role in erection and ejaculation. When these muscles are strong and coordinated, they help trap blood inside the penis during an erection, keeping it firm. When they are weak, erections can be less rigid or fade more quickly. Now here is the connection. Masturbation itself does not weaken erections. In fact, in many ways, it is a form of use it or lose it training. Just as lifting weights keeps muscles active, regular erections and ejaculations keep penile tissue oxygenated and flexible. Studies published in BJU International have shown that men who continue to have regular sexual activity, including masturbation, maintain better erectile function compared to those who become sexually inactive. That said, the way a man masturbates can matter. For example, very tight grip or overly aggressive techniques may condition the body to respond only to that type of stimulation, making partner sex more difficult. This is not because the penis is damaged, but because the brain becomes conditioned to a specific pattern of stimulation. Think of it like training only one muscle in the gym and neglecting the others. Your body adapts to what you practice. The good news is that this can be retrained. Gentle variation focusing on sensation rather than speed and occasionally practicing with different techniques can help maintain sensitivity and adaptability. Another key point is pelvic floor training. Kegel exercises are often thought of as something only women do after childbirth. But research from the British Journal of Urology shows that pelvic floor strengthening can significantly improve erectile function in men with mild to moderate erectile dysfunction. Simple exercises such as contracting the muscles you would use to stop urine midstream, holding for a few seconds, and repeating several times a day can enhance blood trapping in the penis and improve rigidity. Here is the takeaway. Masturbation does not make erections weaker. Age, blood vessel health, and pelvic floor strength are far more influential. If erections are changing, that is a signal to check cardiovascular health, exercise habits, and muscle conditioning, not to blame masturbation. Here is one simple tip. Start a daily habit of pelvic floor training. Aim for 10 to 15 contractions 3 times a day. It is discreet, it costs nothing, and over time it can make a meaningful difference in erection quality. So instead of fearing that masturbation is draining your strength, see it as one more opportunity to keep your sexual system active and responsive as long as you are mindful of balance, technique, and pelvic health. When most men think about masturbation, they focus on the physical side, the prostate, the penis, or testosterone. But just as important, and sometimes more impactful, is what happens in the brain. Masturbation is not only a physical act, it is a neurological and psychological event that taps into some of the most ancient reward pathways in our nervous system. Here's what the research shows. When a man becomes aroused and reaches orgasm, the brain releases a cocktail of neurotransmitters. Dopamine, the reward chemical, surges, creating a sense of pleasure and satisfaction. Oxytocin and prolactin are also released, producing feelings of relaxation and sometimes even bonding, even if there is no partner involved. Endorphins, the body's natural pain relievers, also spike, which is why some men report relief from headaches or pelvic tension after climax. This neurochemical shift has real effects on stress and sleep. Studies from the National Institutes of Health have found that orgasm, including through masturbation, can lower cortisol levels, the body's primary stress hormone. Lower cortisol means lower blood pressure, reduced inflammation, and a calmer nervous system. In fact, some men over 50 notice that masturbation before bed helps them fall asleep more easily because of the sedative effect of prolactin and oxytocin. But here's where nuance matters. Like any activity that stimulates the brain's reward system, masturbation can become a coping mechanism for stress, loneliness, or boredom. While occasional use for relaxation is perfectly normal, relying on it excessively can blunt motivation or interfere with natural energy rhythms. Think of dopamine like a currency in the brain. Spend it wisely and you feel rewarded and focused. Overspend it repeatedly and the brain becomes less sensitive, requiring more stimulation for the same effect. This is particularly important in older men because dopamine sensitivity naturally decreases with age. That means moderation is key. Masturbation can be a tool for relaxation and stress relief, but if it becomes the main or only strategy, it may tip into fatigue or lower mood. Let me give you an analogy. Imagine masturbation as a glass of wine. For many people, one glass can help them relax at the end of the day. But if it becomes a nightly bottle, the brain begins to rely on it, and other healthy strategies, exercise, deep breathing, meaningful social interaction fall away. The same applies here. So what is the practical takeaway? Use masturbation mindfully as one of several tools for managing stress and sleep, not the only one. If you find that it leaves you energized and relaxed, that is your brain's natural chemistry at work. If, however, you notice that it leaves you drained, irritable, or disconnected from your partner, it may be worth adjusting frequency or adding other stress relief practices. Here is one tip you can start today. Experiment with relaxation techniques alongside masturbation. For example, practice 10 minutes of deep breathing or gentle stretching before bed. If you find that you still feel restless, then masturbation may complement these strategies rather than replace them. Over time, this balances the brain's dopamine system and supports long-term mental health. And remember this, the brain and body are deeply connected. Sexual release can be a healthy reset for the nervous system, but it is not a cure-all. Balance is the goal, and balance is achievable. Up to this point, we have talked about the benefits and neutral effects of masturbation. But there is an important side of the conversation that deserves honesty. For a small percentage of men, especially as they age, masturbation can become unbalanced. It is not the act itself that is harmful, but rather the frequency, the patterns, or the way it replaces other forms of intimacy and self-care. Here's what the research shows. The American Urological Association and mental health studies highlight that compulsive sexual behavior, including excessive masturbation, is not defined by a specific number of times per week, but rather by its impact on daily life. If masturbation interferes with work, relationships, energy, or emotional health, it may be tipping into harmful territory. Think of it like food. Eating is healthy and necessary, but eating for comfort in a way that disrupts health, for example, constant overeating, is where problems arise. Masturbation works the same way. It becomes an issue not because of the act itself, but because of its role in a man's life. For example, some men rely on masturbation as a primary way of coping with stress, loneliness, or frustration. Over time, this can create a cycle where the brain becomes conditioned to seek dopamine release from sexual stimulation while neglecting other sources of fulfillment, such as exercise, conversation, hobbies, or partner intimacy. Another concern is death grip syndrome, a term sometimes used to describe men who condition themselves to very specific high-pressure stimulation during masturbation. This can make partnered sex more difficult, not because of permanent damage, but because the nervous system adapts to one pattern. The solution is not abstinence, but retraining using gentler techniques, slowing down, and allowing arousal to build gradually as it would with a partner. Addiction is rare but real. The World Health Organization recognizes compulsive sexual behavior disorder as a condition when it significantly impairs life. It is estimated that about 3 to 6% of the population may struggle with this. For older men, the risks are often less about compulsion and more about avoidance. Avoiding intimacy with a partner, avoiding emotional vulnerability, or avoiding addressing deeper health issues by retreating into private release. Here's the takeaway. Masturbation is healthy when it is balanced. It becomes harmful when it replaces connection, interferes with responsibilities, or feels impossible to control. If you ever notice these patterns, it is not a sign of weakness. It is a signal to seek support. Urologists, therapists, and sexual health specialists see this every day. And the good news is that it is treatable through both behavioral strategies and, in some cases, therapy or medication. Here is one practical tip. Ask yourself this simple question. Am I choosing this or am I escaping into it? If the answer feels more like escape most of the time, then it may be worth adjusting habits or talking with a professional. Balance, not abstinence, is the goal. And remember, you deserve clarity, not shame. For the vast majority of men, masturbation is harmless. For those who find it interfering with life, support and solutions exist. You do not have to carry that burden alone. By now you have heard the science. Masturbation does not drain testosterone, it does not damage the prostate, and it does not inherently weaken erections. It can even support mental health and relaxation. But this leaves one question that almost every man asks in my office. Doctor, how often is too often? Here's what the research shows. There is no universal number that defines healthy or unhealthy frequency. Some men in their 60s masturbate once a week and feel satisfied. Others may do so several times per week and remain perfectly healthy. The key is not the number, but the impact on your overall life. If you feel energized, connected, and balanced, your frequency is likely fine. If you feel fatigued, disconnected, or compulsive, it may be worth adjusting. Medical studies suggest that men who ejaculate between 4 and 7 times per week tend to fall within the range of what researchers consider average and healthy. But again, this is not a prescription. It is simply a pattern observed in population studies. What matters is whether the habit supports or hinders your energy, mood, and intimacy. Think of it like exercise. For one man, walking 30 minutes daily is enough. For another, lifting weights 5 times per week feels right. The principle is the same with masturbation. It should fit your body, your health, and your goals. Now, let us talk about habits. If masturbation is part of your routine, keep it intentional. Choose a setting that feels comfortable and private. Avoid rushing or forcing it. Allow arousal to build gradually. This not only makes the experience more satisfying, but also supports healthy nervous system patterns. Another tip is to balance solo activity with partner intimacy if you are in a relationship. Masturbation should not replace connection. If you find that you consistently prefer solo activity because it feels easier or more predictable, consider whether pelvic floor training, open communication, or even counseling could help strengthen your partnered experience. Boundaries matter too. For example, avoid using masturbation as your only stress relief tool. Pair it with other strategies, exercise, social connection, deep breathing, or hobbies. This prevents over-reliance and keeps your brain's dopamine system balanced. For men with prostate concerns, moderate ejaculation is considered safe and in some cases may even be beneficial, but always combine it with regular checkups and screenings, especially after age 50. Masturbation cannot replace medical care. Here is a practical guideline you can start with today. Ask yourself 3 questions after masturbation. 1, do I feel physically better? 2, do I feel emotionally better? 3, did this interfere with something important in my life? If the answers to the first 2 are yes, and the third is no, you are in a healthy range. If not, consider small adjustments. And finally, remember this, masturbation is not a test of masculinity or morality. It is simply one aspect of your sexual health alongside nutrition, exercise, sleep, and emotional connection. When you see it through that lens, it loses its stigma and becomes just another part of a balanced health routine. We began this consultation with a question that so many men quietly carry: is masturbation hurting me as I get older? By now, you have heard the science, the myths, and the reality. And here is the truth. Plain and simple, masturbation is not the enemy of men's health. Here is what the research shows. It does not drain testosterone, though hormones naturally change with age. It does not damage the prostate, and in fact, frequent ejaculation has been linked to a reduced risk of prostate cancer in large Harvard studies. It does not weaken erections. Instead, erections are influenced by vascular health, pelvic muscle strength, and overall lifestyle. And in the brain, masturbation can reduce stress, release tension, and even improve sleep. We also discussed the nuance. Masturbation is not a cure-all. If it becomes excessive, compulsive, or used as the only tool for stress relief, it can tip into imbalance. And like any behavior, it works best when practiced in moderation, with intention, and alongside other healthy habits. So here is your takeaway. Masturbation is simply one piece of the sexual health puzzle. It can be neutral, beneficial, or problematic depending on context. But it is never something to fear, and it is certainly not something to feel ashamed about. Shame and secrecy do more harm to men's health than masturbation ever could. If there is one action you can take today, let it be this: start looking at your sexual health with the same clarity and care as you would your nutrition,